Hi everyone, this is Dr. Heather Austin Robillard again, and today we are going to go over assessment of motivation and readiness to change. Why this is important is because you will be tested on the ICRC licensing exam if you would like to become a licensed chemical dependency counselor. And these specific tasks, knowledge, and skills will be what we will go over in this lecture video that can be found on the test. Stages of change and using it to promote engagement and treatment, screening, brief intervention, and referral for treatment, selecting and administering assessment instruments, and the various manifestations of client ambivalence related to their readiness to change. So these next couple slides, we're going to focus on motivation and readiness to change assessment tools that can be done through interviewing. One example is a readiness ruler. This was primarily developed with a motivational interviewing technique in mind, as well as screening brief intervention and referral treatment, or SBIRT. It starts with a conversational starter and then a means to quantify various aspects of the client's readiness to change for different domains. Let's take a look at this. This is the importance ruler first. Overall, the importance ruler identifies how important it is for this behavior of the client to change. For example, on a scale of 0 to 10, how important is it for you to change the frequency of your drinking? Then the client would answer that question and you could add a follow-up question to it. So why might you be at a 4 in the importance for giving up drinking or changing the frequency of your drinking and not a 6? You can also gather important information based on whether they chose a lower number or a higher number. For example, you mentioned that you're at a 6 of importance of quitting drinking. Why is it that you're not at a 3? So then you're looking for the strengths that maybe they've had or the differences of why they aren't at a 3 anymore. And then if they chose, if you want to look at a higher number, you can say, you mentioned that you're at a 6 on the importance of quitting drinking. How are you not at a 6? How are you at a 6 instead of a 9? Then that gives you maybe some information about what could get them to a 9. And then we'd be looking at the confidence ruler. On a scale of 0 to 10, how confident are you that you could quit drinking? Then based off of the client's answers, you could ask some follow-up questions like, what would help you get from a 5 to a 10? Whatever the client's responses to those questions gives you an opportunity to begin another type of conversation on where you can move forward in the change process for them. Another way to assess for motivation and readiness for change is using open questions to evoke change talk. For example, if you're looking to evoke change talk in their desire, you might ask a question like, how would you like for things to change in your life? Or how do you want your life to be different from a year from now? If you want to evoke change talk in their abilities, you might ask questions like, what do you think you might be able to change? Or what encourages you that you could change if you decided to? Another part of change talk would be reasons. Like, what are some of the reasons you have for making this change? Or what are the downsides of the way things are currently? And then open questions to evoke change in need. What needs to happen? Or how serious or urgent does this feel to you? All of these questions give the client some space to kind of think about the future or think about what's going on right now and what they might want to change, instead of just asking them, do you want to change or do you want to stop drinking? Here's another way for you as a clinician to look at this as kind of like a decision balance sheet, right? What are the advantages or disadvantages of changing or not changing? So you're going to explore with the client the pros and cons of their drug use, or the pros and cons of them changing their drug use. This taps into functional analysis. What is the function of their drug use? Why are they using? Includes results in the report as areas in which counselors can work on. So when you're writing a treatment plan and you're doing the recommendation part, this can kind of give you some information on what kind of treatment they would need because of the reason that they drink or use drugs. Other variables you may want to ask are the perceived barriers for treatment. Like, what are the reasons they may not want to go to treatment? Is it financial reasons? Is it family? Is it shame? There are an item 50 item measurement that exists, but it may be too long. You might also want to ask about the number of prior treatments and the results that they had. What did they like? What did they not like about this prior treatment? There's another assessment tool that's 69 items to measure this as well. All of these things kind of tap into the treatment-related issues or anxieties and concerns, which might deter their motivation for change. So these are some of the typical reasons that clients give for their reluctance to seek treatment. Typically, it may be that they believe there's an absence of the problem. They are in denial of it. That they have a negative support system, like they're going to lose all their friends or their family. Fear of treatment, a fear of what it would look like, or a fear of the unknown. Maybe they have some privacy concerns, like they don't want people to know their business. Time conflict, work, school, whatever conflict might be in the way. Poor treatment availability, like maybe they don't have places they can go easily. Admission difficulty, maybe all of the beds are full in their area. Now let's take a look at some of the motivation and readiness to change assessment measures that are less about just interviewing questions, but actually have tools and questionnaires. The first one we're going to look at is called the URICA. It is the University of Rhode Island Change Assessment Scale. The URICA measures scoring for alcohol, drugs, and psychotherapy. It ranges from 12 items to 32 items, and it closely maps the stages of change like pre-contemplation, contemplation, all of that kind of stuff. And we do know that the psychometrics show on a norm sample, which means it's a reliable and valid measurement. The cutoff scores can be created for the readiness score, but it is important to consider your population and how conservative you want to be. The cutoff scores are technically arbitrary, and you should be thinking about the stages as least ready, middle, and most ready. But the general population, the following cutoff scores have been appropriate. So if they score 8 or lower on this test, they're classified in pre-contemplation, 8 to 11 as contemplation, 11 to 40 as preparation or action. For intensive service populations, it may be more important to only score in the range of 12 to 14 to classify those in preparation or action. Next, we're going to take a look at the SOCRATES, which is the Stages of Change Readiness and Treatment Eagerness Scale. This is a public domain measurement, and it has the availability for the scoring sheet. The most recent scale version has 19 items. It does not map out on the stages of change, but close. And here are the psychometrics, which show that it does have reliability and validity. We do not recommend making clinical decisions based on the SOCRATES scores. However, it is a useful screening assessment for motivation, and they do predict outcomes. But like other brief screening instruments, it should be used clinically to suggest areas for further discussion, not necessarily for diagnosis. So as I said, it does not necessarily map out strictly with the stages of change, but it does have similar things in that it talks about recognition. So they have higher scores will have recognition of their problem drinking. It also talks about ambivalence. Higher scores will say that they sometimes drink too much, whereas lower scores wonder if they are drinking too much. And then it talks about taking steps, where higher scores report that they are already doing things to make positive changes, and lower scores report that they are not currently doing things to change. So somewhat similar to the stages of change model. The RCQ, Readiness to Change Questionnaire, is a public domain measurement, so it can be found publicly, and it's 12 items, and it follows along with pre-contemplation, contemplation, and action stages. And again, the psychometrics show that it's reliable and valid. It is a quick and dirty type of test, and you're primarily looking at the scores in whichever stage they score the highest, and that is likely the stage that they are classified in. So remember, with any of these measurements, we're looking to promote engagement. The intervention is not really our thing, but the recommendation might benefit if the client is ready or not ready. So knowing what their motivation will give us some insight into what might be the best recommendation for treatment, as well as, their withdrawal and tolerance that we've talked about in previous modules. Thank you and have a wonderful day.